Okay, in this video I want to show you how to go about finding the best healthcare provider in your state. And I was looking around quite a bit because I'm looking for health insurance for myself. And the best place that I've found while searching for a few hours is Consumer Reports. They put out basically a long summary of the best insurance companies, and they rank them from 5 to 1 as far as consumer satisfaction, prevention, and treatment, and of course if they're accredited. And basically what you could do, I'll go ahead and put the link in the body, so you can just go directly to this Consumer Reports, and it's very telling. And some of the insurance companies, not to mention any names, that I thought were great. They had like a 1 or 2 star rating in treatment, prevention, a lot of things, and then so I'm willing to pay a little bit more per month to get one that has good ratings. So like when you go to Consumer Reports page, you could rank it from overall score, high to low, but you can see there, and you could alphabet it through A through Z, alphabetize it, kind of customer satisfaction, high to low, and treatment, prevention, high to low. But the one I say to go to is the overall score. So for example, if we go here to the state, you can do private HMO, private PPO, the Medicare, and then state. Let's say if you choose, for example, let's say you choose Pennsylvania. Alright, and then you go. Alright, and then this is going to show you for Pennsylvania the number 1. And out of 100, you want to get it close to 100 as you can. For example, in Pennsylvania, they got like this one company, and I can't even pronounce it. It's called Geisinger Health Plan. Gets 5 out. They get a total of 88, but they get 5 on all 3 of the things to go for. Health America Pennsylvania is an 87 out of 100, which is really good. And if you go from low to high, you can see here's some very reputable companies that get like a 3, which is actually not as bad as my state. My state had a lot of 1s and 2s there on the very bottom. So I'd recommend going there before you choose. If there's one that you're leaning towards, I'd recommend you Google it. And you can Google it. What you do is you just type in the name of the insurance company you're thinking about, and then type in review. And then you can see here what the reviews, like this particular one that I just typed in, has 472 complaints with a 1 star. Okay, so you can do what you want to. With me, I'm not going to go with that particular company. And then when you go to HealthCare.gov, you have this year, it's December the 14th, you got till tomorrow, December the 15th, to apply to get covered, start getting coverage by January the 1st of 2015. However, if you sign up by February the 15th, I believe, you can get coverage starting April the 1st. So, and you can get started without actually having to put your information. You select your state. We'll put Alabama here, and then you can see plans and prices. And to go to, of course, they call it Obamacare as well. To go there, you just go to HealthCare.gov, and then you type in your zip code, whatever it is. Let's see, I'll type in some random zip code, and let's say my income is $25,000. Alright, let's say my age is 50 and I'm a smoker. A lot of people have not been putting smoker when they are smokers. Of course, it's always good to be honest. And then you're done with this step. and the lower income you make, the more of a tax credit you get. I put 25,000 on here, and it says the household may be eligible for 257 per month premium tax credit to use right away to lower your monthly premium cost. Okay, so we start out with the plans. You can go through 3 different plans. There's bronze, silver, and gold. And I know some states actually have platinum. But basically what that is the more money that you pay in every month, the lower your estimated deductible will be. So for example, this is crazy, this says like 44 bucks per month that you would pay. But in order, you pay that, but when you start going to the doctor and you start getting procedures or whatever, you have to spend a total of $6,000. That's your estimated deductible. You have to start paying $6,000 in order for it to start kicking in to where your insurance company will start paying. So the more estimated monthly premium you pay, let's say if you pay $400 or $500, I've seen where you can pay $400 or $500 a month and your estimated deductible is 0. So you don't, they automatically start paying. So you need to weigh your pros and your cons. If you think you're pretty healthy, you can go ahead with the lower premium. If you're not healthy, then you'd probably better to go with a higher premium in order to offset your costs. And then of course it lists here the co-payments with primary doctor, specialist. I see generic drugs, I usually see it around 10 or 20 bucks depending on your plan. But anyways, that's a little rundown. I think I basically just want to address the best way to choose the best health insurance company for you, because I think that's where a lot of people get stumped. I mean, you could get a good plan that you think is good, and then all of a sudden you get all these reviews where people are being hassled. Where I saw one incident where one company, the doctor suggested one treatment, and the night before they were about to go into treatment, they got a call from their doctor and saying, hey, we can't do that procedure. We don't deem it necessary. The insurance company didn't deem it necessary to do the operation. And when I looked on Consumer Reports, their rating was like 1 for prevention. So keep that in mind. All right. Hope you enjoy the video.